Right now we had 18,000. As I told you, we were about to receive a very significant, we have received and will be distributing out over the coming number of days, over the weekend. Probably it'll be starting next week, further 188,500 doses, much of which will go into this program. So that's the issue. The issue is supply, as it always is. We would like to be immunizing way more people in BC, but we're immunizing to the supply that we have. And again, this isn't a criticism of the Government of Canada. We don't have domestic capacity. Really, the countries that are well ahead of us in the percentage of immunization have the domestic capacity to produce vaccine. We don't have that in BC. And so we're limited by supply. And so it's inevitable when you have this much demand for vaccine, more demand for vaccine in an age cohort than you have vaccine available. There are some people who aren't going to be on that. But we're working closely with the Pharmacy Association and with pharmacists across BC. I think they're going to do a great job. I am so proud of the work pharmacists did in the influenza campaign. And the key point for everyone is everyone is going to get access to their first dose by the end of June. That's what we are seeing now, given the supplies we expect to be coming. Everyone is. But whether you're vaccinated or not vaccinated, it's critical right now to follow public health rules. I'll give you one example as to why. In Prince Rupert, we've immunized about 9,000, a little over 9,000, I think it's 9,008 people in the town of Prince Rupert in our campaign, in our effort there in the last week, our all-of-community effort in Prince Rupert. In the last number of days, the last 4 days leading into today, I believe 67 people tested positive for COVID-19, partly because they would have had the transmission prior to their immunization, but also because, as Dr. Henry has explained now in some detail and did today, it takes some time for the vaccine to take full effect. So what that means is that everyone's going to get their chance before the end of June, and our determination, my direction, is to get vaccines into the hands of the most vulnerable first and to get it out as quickly as possible. And that's what we've been doing in BC. We're only limited by the amount of vaccine we have, and we're delighted every time any vaccine arrives in BC, as it did today.
Dr. Henry, we haven't seen the variant numbers in a few days. I'm going to assume the variants continue to climb. Why are we not doing anything specifically to address variant spread? I'm sure you've heard from other experts who say that we should be adjusting parts of our plan to note variant spread. I'm just curious why we're not, and is there anything specifically that can be done around the Easter long weekend when people may be more likely to gather indoors for supper or for a holiday gathering?
Yeah, so we did report on the variants, and it'll be in our statement today. But I can tell you over the last 2 days, because it's the whole genome sequencing is only run periodically during the week, and they missed a day. So we had 90 new cases identified as variants in the last 2 days. The 80 of them were B117, one more of the B1351, which is associated with South Africa, and 9 more of the P1, which is Brazil, which we've been watching very closely. Most of the P1 is one of the ones we're most concerned about, is in the Vancouver Coastal Health Region. And we have, of course, adjusted our approach to ensure that we're doing surveillance. So now we have over 90% of all of our positive cases are screened for variants of concern, and there's a delay. It takes a day to do the screening test. We screen for a specific marker, and then we do the whole genome sequencing to see which specific variant it is. So what we know about these variants of concern, we've talked about, they spread more easily in most cases, and in some cases they lead to more severe illness. We're also concerned that some of them seem to have a reduced response to some of the vaccines, although new data that's come out this week has shown that particularly the B117, all of the vaccines that we have in Canada work well, and same with the P1. It's the B1351 that is a little bit more concerning, but it still has good response. So what we also know is they may be more transmissible, but the very same things that we do to prevent the old viruses that we were seeing are the things that work for this as well. But what we know is that margin of error is that much less, that it can spread more easily. So we're seeing more contacts who become positive as well with some of these variant cases. And yes, we're doing additional testing. You saw that in some of the exposure events we had in schools, particularly in Surrey, around the B117, and thankfully what we found was that there was not transmission in the schools for the most part. So that's good news. We are doing additional testing, but every single case in BC is followed up, whether it's a variant or not, and we often don't know until a couple of days later. So we are watching carefully around hospitalization rates and people who end up in ICU. I can tell you that especially we've been investigating, there was a large cluster in Vancouver Coastal. That is now contained, and there's been an increase in these P1 in Vancouver Coastal and Whistler, and some of that has spread to other parts of the province in very small numbers, but we are watching very carefully and following up people very carefully. But there's no focal super spreading event that's related to these. What we're finding is there's small chains of transmission in multiple areas that aren't linked